So in this today's video, we are going to discuss a very important topic about the cost of hair transplant. And we will be taking questions from anybody out there. We do get these queries or questions that why do the hair transplant cost vary from one center to another? And it's a very valid question. And what we see in our practice, there are various clinics which are charging as low as 10 rupees per graft. And then there are a lot of clinics which are charging 300, 200, 250 rupees per graft. So obviously, it is very, very confusing for any person who is starting their hair transplant journey to get confused why this cost is varying so much from one place to another or one clinic to another. And there are a lot of factors to it, friends. If you also have any particular query about this, you can mention that in the chat section here. And after seeing that question, we will be able to answer that very properly. But from my point of view, what I want to share is that the most important thing is when you are going for a hair transplant is to find out who the doctor is who is going to perform the hair transplant for you. Who the doctor is who is going to perform the. So, as per the National Medical Council guidelines, who can perform a hair transplant? It's either a plastic and a cosmetic surgeon, or a dermatologist, or a registered medical practitioner who has got sufficient training into the field of hair transplant. Yes, so the same question has been mentioned by Mr. Ram Kiladi Sharma here that sir कौन सा डॉक्टर hair transplant कर सकते हैं. So, as per our National Medical Council of India guidelines, the performing doctor should be a plastic and a cosmetic surgeon, and or a dermatologist, or a registered medical practitioner who is trained, has got a long training in the field of hair restoration surgery. So again, whom you should prefer, it's your individual choice. You go and take consultation with many doctors. Never decide about hair transplant in a single short brief consultation, or I mean just sending a picture and getting a quote. That is not the only thing which you should be looking out for. You, if you have 5 or 6 consultations from different clinics, then you find out which doctor is using sort of advanced softwares like trichoscopy for the planning of your hair transplant. So now trichoscopy also, there are various trichoscopes there. The basic ones, they just see your hair in the donor side and just show it to you on a screen. So that's very, very basic. It does not give any information, whereas the advanced top softwares will give us a detail about what's the average thickness of hair, what's the terminal is to vellus ratio, what's the average density in different areas, and what's the average number of hairs per graft, or what's the coverage value, which and what's the total number of grafts, how many grafts can be extracted. All these information in detail are available through trichoscope. And also, if that clinic or the doctor, when you enter their chamber, there sometimes doctor will just look at the head and say 2000, 2500 graft, 3000 graft. So friends, that's not the proper way. It has to be mapped, it has to be measured. Your bald area has to be measured, your grade has to be quantified. There are 7 grades, grade 1 to grade 7, and the doctor should ideally measure your bald area and make a plan, a single sitting plan or a 2 sitting plan. If a person is grade 6 or grade 7, uh, then in that case, you may need more than one sitting also. So that kind of planning, do look out whether they are taking a keen interest, or they are just, you enter them 2 minutes, they will say 2000, 3000, 4000 grafts, and after that, just giving you the quotation and then continuously following you up with the sort of discounts and trying to convert you into a patient. But this is not the way it should be planned. Hair transplant has to be customized. The planning for a grade 1 or a grade 2 or grade 3 or grade 4 patient is different from grade 6 or grade 7, and that has to be scientifically planned out. So even in those doctors who are qualified, like a plastic and cosmetic surgeon or a dermatologist or a RMP with a sufficient experience in that, please try to choose the ones who are regularly attending these international or national conferences in the field of hair restoration, and and they are members of ISHRS, ABHRS, AHRS, which is ABHRS is American Board of Hair Restoration Surgery, ISHRS is International Society of Hair Restoration Surgery, and AHRS is Association of Hair Restoration Surgeon of India. So if they belong to any of these organizations, the criteria to get included in these organizations is very strict. It's not that you pay a money and get some certificate for these. They are very stringent criteria of inclusion, and they also focus a lot on sharing their information. They are holding their conferences or workshops very regularly, and the doctors, the members are also quite updated. So even in those credentialed doctor, these are the ones you should prefer. Then planning we have discussed. Now let us take some questions from the chat here. That yeah, one question we have seen here is unlimited grafts. What is unlimited grafts? So friends, there is nothing like unlimited. We go to a restaurant which has unlimited thali. So if it's like 300, 400 rupees or 500 rupees thali, but doesn't mean that you can eat more than what your capacity is. So similarly, every donor site also has a capacity, the number of grafts which can be extracted in a single sitting. It's not that unlimited means 10,000 or 20,000 grafts will be inserted and your problems will be solved forever. So this is a misleading term. In fact, if you go on our channel and watch one of the videos where we have discussed 7 unethical practices which the clinics do about hair transplant, one of them is that giving such false assurances like guaranteed results, unlimited number of grafts, and things like that. So there is nothing like unlimited grafts, and it's a basically unethical practice to market hair transplant with these terms like unlimited graft. कौन सा hair transplant कर सकते हैं? We already discussed this. Hmm. So another question is hair transplant, how to choose a clinic. That's what we are discussing. Credentials of the doctor, how they are planning out, what kind of instruments they are using, what kind of punches they are using. Are they poor quality punches? Because if they are poor quality, they will be cheap and the procedure will be cheap, but the results will not be very good. Also, if they are reusing the same punches again and again. So ideally, they should not be reused from one to another sitting. It should be a single time use of all these consumables. Also, uh, a very important thing is that the kind of machine which is used to harvest the graft. There are a lot of machines, but always it's your right to ask the doctor which FUE machine you are using to take out the grafts, to extract the grafts. So, mostly if a clinic is using a dental drill, I would be very cautious because these machines they have a specifications made out for dental procedures, and their speed is very high. The RPM may go up to 30,000 rotation per minute, which means in a single second they may rotate 500 times or so, which is, it's very, this procedure is very precise. We just have to centralize your punch over a follicular unit and then just go inside, score the skin, and take out the graft in a proper way. At a very high speed, there are higher chances of damage or transaction happening to the transplanted hairs. So ideally, FUE machine should have a very low speed, low torque, so that every graft, every root which comes out, it's very good in quality, and every root is proper, and there are higher chances of survival when the graft is intact. It is not damaged. Just the physical damage is not even enough. If high speed machine can cause thermal damage also, because there is a lot of heat production when the machine or the punches are moving at a very high speed. So just see, there are a lot of variation in the machines and instruments is very high. There are very cheaper machines and instruments, and then they're very costly ones. So it's your right to ask what kind of consumables machines are being used by that clinic. Also, you have the right to see the OT facility. If you're going for a consultation, you can always ask that clinic to show you the OT facility, whether they are, there are like as per the NMC guideline, every clinic should have a defibrillator, there should be oxygen monitor supply, and ideally, as per the NMC 2022 September guidelines, hair transplant should be performed in a hospital setting, and which should have all the emergency measures like emergency medicines and all these things in. I mean, their availability should be there. It should not be that it's just a single room without any facility. No doctors are there. There is no supervision. There is no monitoring of the doctor. No investigations are done, and the OT is very unhygienic. In these kind of cases, you can have infections and things like that. So it's not just that the just the cost, which is it's also what kind of facilities are being used in that center. Now, also, a very important point which I would like to discuss is the team. So, hair transplant is a team procedure, and you have to understand that it's not a single doctor who is performing the entire procedure by himself or herself. It's that there's a team, and you should always ask the doctor or the clinic what kind of team they have. If they are calling the team on that particular day only, and they are not the permanent members in the team, then in that case you you should avoid that clinic, or you should choose a clinic which has a fixed team. Because here, if a clinic has a fixed team, that means doctor spends a lot of time with his team members and tells them or updates them about all the recent things which are going on. They discuss if there are failures, they discuss that also with their team, and how to keep themselves updated. So this is very, very important. And I think I missed out one question, which was about the, what was it, doctor? Yes. So there's a question, graft कैसे पता करें? How many grafts have been inserted? So a good machine will always have a counter, or there will be a foolproof method to ensure that all the patients, they know about the grafts. So we had a patient who was told that they have done 4,000 grafts. And when they came to us, the results were very poor, and there was just a hairline. And we measured it with the trichoscopy, and we found out that only around 800 grafts were there. It was not 4,000 graft. And he said that they were doing very cheap, 15 or 20 rupees per graft. And but ultimately, if you see, it is very costly. So, and his backside, at the donor side, lot of grafts were taken out, harvested. Probably more than 3,000 grafts were harvested, and only 700-800 grafts were going here. That means the damage rate was around 75% in that case. And overall, it's not just the money you are losing your precious donor hairs at the back also. So there should be a way by which you should know that how many grafts have been extracted and inserted in your case. That's very, very important. Do ask for a detail from the clinic whenever they are doing a procedure. Always ensure that there is a way in which you know that how many grafts have been extracted. Sometimes these clinics, a good clinic will display this also, and either on an electronic machine. The good machines, a graft harvesting machine will have an electronic display, or sometimes the clinic will show this on a board also. They will write the number of grafts on that board also. So these are a few important points. Also, I want also, whenever you're booking a transplant procedure with any of the clinic, do ask them if there are any hidden cost and what all is included in that cost. So I know of a clinic, I mean, a patient who told me that they were planning a hair transplant, but they went to that clinic, they asked for a very huge amount, saying that this is the operational cost, which is separate from the cost they given to them on the day of the procedure, which was quite shocking, and they felt betrayed by this particular piece of information. Another last important point, very extremely important point, which you should ensure that whenever you go for a consultation, do ask the clinic or the doctor who is consulting you that what are their protocols in case the hair transplant fails. Because friends, you know that uh, it's not that every clinic is giving consistently 100% results. There are some unexpected failures which can happen in any of the cases, because this is a medical procedure. So you should ask the doctor, in case the hair transplant is not successful, what kind of protocols they have in place. Because a good doctor, if they have a failure, they will go for biopsies to find out why that has happened, if there are any autoimmune skin disorders. And then after finding out those factors, they will, if there is no autoimmune disorder, it's just because of some loss of the previously existing hair, which has resulted in the thinning or lack of density, then they will put up or top up more grafts. So in a good clinic, they will have a plan in case it fails, rather than a clinic saying 100% guaranteed results. So that's a misnomer. So in this video, what we have discussed is that uh, there are a lot of ways by which, because of which the cost will vary from clinic to clinic. It can be the doctors, it can be the consumable punches, team, OT facility, if they're hygienic. Obviously, if the OT is fully equipped and fully equipped with all the safety precautions and things like that, it is going to be costlier as compared to a clinic which is just nothing at all. We had a patient who underwent a hair transplant at a clinic where there was no doctor, and his blood pressure was very very high, and they tried to give him multiple medicines, and his blood pressure just came down very very low. And then they just they just pulled the shutter down, and the patient was just lying there. Then they came to us, and then we had to see and do whatever we can for the patient. So please ensure that the OT facility is properly equipped to deal with any kind of emergencies or complications. The protocol should be such that proper investigations should be done. In fact, today we had a patient, and in his blood test there was some problem, so we postponed today's patient of hair transplant because we cannot take risk. It's a cosmetic procedure which is in which safety is a primemost concern because of various factors like this. But it's a service industry where the cost will always vary. It's just like you are going to purchase a piece of art, and the cost of that art piece may vary. One artist may be cheaper, one may be costlier, depending on the seniority, depending on the artwork. So every service industry, the clinic has the right to choose their cost, and but it should be transparent. And then if you are okay with that, if it fits your pocket, if you feel that the consultation is good, the previous results of these clinics are good, you feel that you have a sort of a connection with the team and the doctor, then you should decide on that factor. But just to give you a thumb rule, in India, the cost is can vary from 15-20 rupees up to 200-300 rupees also. But it should be reasonable. India, same procedure will cost quite costlier in the European countries or US, because the running or operational costs are quite low in India when it is compared to other places, because somehow the manpower is not that costly, the running costs, the rentals, and things like that, the location, and that's not as costly in the Western countries. So India is definitely cheaper to many places, but still there are a lot of good clinic and good doctors delivering best of the hair transplant services in India at quite affordable and cheaper cost than the Western counterparts. So, friend, this is in brief about the cost of hair transplant, and we will be trying to arrange more of these live sessions in the coming time, probably once in every week on Saturday from 6 to 6:15. That's a designated time. There may be, we will try to be very punctual with that, but sometimes because of some other commitments, we may not do that. But this is something we plan to do. Suggest some topics if you want for the live sessions in the comment section below, so that we can regularly arrange these live sessions. Thank you very much.